Hi, my name is Ray and I've been a nurse for 2 years. To elaborate more on PPD, women who experience this condition, research suggests that there is a 5% suicide rate, which is why these women need to be quickly assessed, treated carefully, and monitored closely by a mental health care professional.
Welcoming a new baby in the world can be the happiest day of a mom's life, but it can also be difficult if the mom is suffering from PPD, postpartum depression. Postpartum depression is a type of exacerbation of blues and stress. There are several hormonal changes, both physical and emotional, that the mom's body go through. Dr. Rachel White says that it is a common diagnosis that can last few days after delivery. 80% of our women suffer from postpartum depression. The symptoms include inability to concentrate, overly emotional, and trouble sleeping. Okay. What is postpartum depression? What is it? It is a depressive illness that the mom's body goes through after delivery, 2 to 4 weeks after delivery. The onset of depression may interfere with the mother's ability to respond to her infant's cues and interfere with the developing infant maternal-infant bonding. Causes does not have a single cause. Yes, does not have a single cause. It's a combination of both physical and emotional factors. And it's not a fault of a mother. Yes, it's not a fault of a mother. Postpartum depression includes inadequate social support, a poor relationship with the partner, and low self-esteem, and probably an unplanned pregnancy. Treatments, a combination of psychotherapeutic drug and antidepressant. Patient teaching would be teaching patient about PPD symptoms, including need to seek help if symptoms don't resolve, because it can get worse. Encourage patient to ask support and help with the baby and housework, and maximize sleeping.
Postpartum psychosis is a rare illness compared to the rate of postpartum depression or postpartum blues. It occurs approximately 1 to 2 in every 1,000 deliveries. Onset is usually sudden, most often within first 2 weeks after postpartum. The symptoms are hallucination, delusions, very irritated, rapid mood swings, and many more. The onset significant are personal or family history of bipolar disorder or previous psychotic episodes. It begins suddenly after childbirth. Symptoms vary and can change quickly, which can last from 2 weeks to 6 months after childbirth. Women with a prior history of bipolar disorder, especially family history, are higher risk. I have a friend who went through postpartum psychosis when she had a third child, and she will tell her experience, what happened to her and how she got treated.
I'm Teresa, and I suffered postpartum psychosis. I have a 3-year-old kid now, and when I gave birth to him, it seems to be like I'm fine and everything is okay. But then as soon as I gave birth to the kid, it seems to be I got so different. I don't notice it, but then my family, like, they keep on telling me there's something wrong with you. There's something going on with you. I keep on fighting with my husband a lot. I don't notice my kid. I don't care about the kid. It seems to be like it didn't came from me, the kid. It's just, I feel different. I feel crazy. I'm hallucinating. I don't eat. I don't sleep. I feel that I'm crazy. But I don't want to admit it. Who wants to admit they're crazy? Nobody. So my husband forced me to go see a doctor after giving birth. So finally I gave in. So after that, the doctor told me, yes, you have this, postpartum psychosis, and they prescribed antidepressant, and they put me on rehab, and I know it's curable. I've been cured. So now they in there, when I was in the rehab, they teach me that I'm important, and so was my baby too.
Thank you so much.
Hi, my name is Suki Sandhu. I've been registered nurse for the last 3 years. Today we're going to talk about postpartum depression. No doubt, childbirth is amazing time for the family and the mom. About 80% of those women right after the childbirth experience this really common condition which is called postpartum blues. So postpartum blues are described as irritability in the mood, frequency in mood changes, irritability, lack of sleep, or tearfulness. So postpartum blues can last 1 to 2 weeks, and if they don't resolve on their own, then that can lead to postpartum depression, which can last up to 1 year. And during the postpartum depression, women can experience a lot of symptoms, which include consistently sad mood, feeling of guilt, anxiety, lack of sleep, and appetite changes. And with all those symptoms together, it is really hard for the mom and the baby to form a bond together. After postpartum depression, about 1 to 2% of those women experience really extreme condition, which is called postpartum psychosis. In postpartum psychosis, what happens is women experience things and hear things that are not normally there, which are called hallucinations. They can also experience extreme anxiety, extreme lack of sleep, which can, and sometimes they can have suicidal thoughts, which can be really harmful for the baby and for the woman. It is considered a medical emergency, so in that case, it is really, we always encourage women, if they experience any of those symptoms, to seek medical help as soon as possible. So the exact cause of these conditions is really unknown, but some of the factors that are considered to be the main risk factors are family history of mental illnesses, bipolar disorder, patient's own history of mental illness, or any medications that have been discontinued due to the pregnancy period is also considered a major risk factor for these conditions. Postpartum blues and really minor cases of depression can be managed at home and are preventable with the family support, with the support from friends and support from the partner. So by sharing the responsibility of taking care of the baby, it can really help women to get some sleep, some attention for herself, and really sharing the responsibility can get you out of the postpartum blues and minor depression cases. But in cases where depression is moderate or too severe, women's gonna need a psychiatric evaluation where she might be put on antipsychotic, anti-anxiety, or mood stabilizer medications. But in case of psychosis, patient needs to call 911 as soon as possible so they can be admitted to the hospital for a couple of days and be under direct observation for medical evaluation.